Yeah, the treatment options available and which are commonly used in head and neck cancers are the surgical ablation of the tumor, radiotherapy, and the chemotherapy. They are used in various combinations depending upon the site of the disease, depending upon the clinical stage, the extent of disease spread, patient's general health condition, and several other factors. Uh, Usually, a combination of these modalities are used, which we call it as a multimodality treatment approach. For example, we take an early oral cancer that is involving either the tongue or the buccal mucosa or the lip. Usually, surgery is the first primary modality of treatment which we usually consider. Depending upon the final report from the surgical specimen, we decide whether the patient needs further treatment with radiotherapy without chemotherapy or not. For example, if we take a locally advanced oral cancer, the patient will usually undergo surgery followed by some form of chemotherapy and radiation. And for a pharyngeal cancers, which are usually lying deep inside the oral cavity, which may be difficult to operate with a reasonable chance of cure, then we usually subject them upfront to radiation along with chemotherapy, which has a higher chances of offering cure with less side effects. For a, but for a very small lesion, though existing deep inside, especially in the tonsils or in the base of tongue, by means of the latest techniques like robotic surgery, we are even able to cure the disease surgically. And for laryngeal diseases like very early laryngeal cancers, then the patient can be treated with chemoradiation so that the voice can be preserved. And but for a very locally advanced laryngeal cancers, the radiotherapy, where the radiotherapy may not be able to offer cure, then we subject the patient to a mutilating laryngectomy surgery followed by radiotherapy.